Greater Manchester will begin taking control of its health budget from April after a devolution agreement was signed by the Chancellor George Osborne. The region's 10 councils and health groups will take over £6 billion allocated for health and social care, with full powers being devolved a year later. Mr. Osborne signed the Memorandum of Understanding, dubbed Devo Manc, for better, more joined-up healthcare. Labour MP Barbara Keeley said, "We're being handed over a funding crisis. From April 1, the region will start making its own decisions which will provide the foundations for a Greater Manchester health and social care strategy." Manchester City Council said this, along with business and investment proposals, would also give a transitional plan for full devolution by April 2016. No NHS reorganisation. Mr. Osborne said, "We have a landmark agreement to bring the local NHS and social care much more closely together. I am excited about all this because not only does it mean the people of Greater Manchester having more control over the decisions that affect their lives, I believe it will also lead to better, much more joined-up healthcare. The agreement does not require any reorganisation of the NHS or its principals," the City Council said. Ms. Keeley said, "The problem with Osborne's offer is that it is on existing budgets. A&E has just been through its biggest crisis for many years, so let's be realistic about it. There are big gaps in social care, our hospitals are in deficit, and that's no way to do a proper job of integrating care, which is Labour's policy, to integrate health and social care at the local level. The agreement is part of the government's Northern Powerhouse plan to close the economic gap between North and South by investing in regions. The plan would see local leaders, and ultimately Greater Manchester's new directly elected mayor, control how budgets are allocated." Anne Barnes, chief executive of Stockport NHS Foundation Trust, said, "It is not about increasing power, but about increasing the health and prosperity of local people. We will have greater opportunities to respond swiftly and effectively to the needs of residents and really transform services for them. They will have a powerful voice in a powerful partnership." NHS England Chief Executive Simon Stevens described the Memorandum of Understanding as a landmark agreement. "It charts a path to the greatest integration and devolution of care funding since the creation of the NHS in 1948, he said. Greater Manchester now has a unique opportunity for innovation and improvement in health and well-being. The eyes of the country will now be on what this new partnership can deliver, and today the work begins.